All right. So, Miss Mariah, I'm gonna be getting you ready for discharge. I'm very excited to go home.
Yes.
Just some important things we have to go over before you leave, okay?
Okay.
So you're gonna be bleeding. It may last for up to 6 weeks. I'm sure you already noticed some bleeding, but it should get lighter. It'll be more like a period, okay?
Okay.
A long period, I should say.
Great. All right.
Some of your medications, you may be on like some Tylenol, just regular pain meds to help with your C-section. And we also encourage prenatal vitamins.
Okay.
If you're going to breastfeed, it's going to help with that. Activity, we want you to get up as much as you can, but don't overdo it, especially since you had a C-section, okay?
To get baby daddy to run some errands.
Yes.
Just not all of them.
Right. Do not overdo it.
All right.
And then we want you to get out of bed slowly. Okay? Make sure you're not feeling lightheaded or dizzy before you get up. Try to do some leg exercises if you don't want to get up as much.
Okay.
But we just want to get you moving. Your C-section incision, pain there will be normal, but it shouldn't be too much or unbearable pain. We want you to splint it with the pillow to help whenever you're getting up out the bed. If you have to cough or sneeze, just use a pillow. That should help ease the pain a little bit. Some signs of infection, you may get some discharge, and if it's like yellow or green or any discharge, honestly, if you start to get a fever or any drainage from your incision site, any swelling or increase in pain or inflammation, those are signs of infections that you want to call and let us know. Postpartum depression, it may last, anytime. It can really start at your pregnancy, during pregnancy, or
girl, I've already got it.
Listen, I know pregnancy is a big change, so it can really start anytime now, after the delivery, up to 4 weeks after. So we just want to make sure that you let somebody know if you start to have any thoughts of hurting yourself or hurting your baby. Let somebody know, because we really want you to get some professional help if that happens, okay? And I also let Dad know what symptoms to look out for, okay?
Yes, thank you.
Yeah, so you may just feel sad or anxious, So just let somebody know. Make sure you're talking to your peers, okay?
Okay.
You should be going to the doctor in 6 weeks for your 6-week checkup. So make sure you follow up with that and get that scheduled. And just some symptoms that require immediate attention. Signs of infection, like I was just saying, the discharge. If your sutures or your staples start to come unloose from your C-section, yes. Any golf ball size blood clots.
Golf ball size?
Yes, golf ball. Okay.
Goodness. All right.
We want you to please call us immediately or go to an emergency room, okay?
Oh, yes, ma'am. You don't got to worry about that.
And if you have to change your pad more than once in an hour, please let us know, okay? All right, those are all signs of like infection or hemorrhaging, okay, that we really need to know and get on top of. Now, as far as baby goes, do you think you're going to breastfeed?
I think so. I think that might be the best route for me.
Okay. All right, so breastfeeding should be, I'd say, about every 2 to 4 hours.
Honey, that's
I know
a lot.
it seems like a lot, but you got to think these are newborns. They sleep a lot. So we want to make sure that we're getting them all the food that they need, because if not, they'll just sleep. Drinking lots of fluids will help with your breast milk and increase that milk production. And then your mature milk won't come in for about 2 weeks, so until then you may not be producing as much, but
mature milk just means like more milk,
yeah,
the amount the baby will need.
And so your baby might need to be on formula until that mature milk comes in. So that should give you a good estimate of how much milk you'll be making once that comes in. And then just remember that whatever you eat, the baby eats. So no alcohol. I know.
All right.
I know. You had to wait 9 months. Now you gotta wait another. All right. If you do decide to use formula for whatever reason, make sure that the baby is tolerating that formula. Make sure that, you know, it's a sensitive one. If baby isn't tolerating it, you might want to switch. It may take a couple times to get the right one for your baby. But just make sure, you know, that they aren't throwing up after they eat or having any gas. You know, you might want to switch it if that happens. Normal daily output, baby should be having at least 6 wet diapers. I know that's a lot.
6?
That's a lot. And they'll have about 3 to 4 stools per day.
Gee whiz, I'm gonna be changing this diaper, feeding all day long.
I know. Yep, in the beginning it's a lot.
Alright, it's okay.
And their stools, it may be like yellow or seedy, just depending on whether you are breastfeeding or not. It can vary.
Okay.
But urine should always be yellow, okay?
Alright, yeah.
If you see any changes in that, call us.
Okay.
Umbilical cord, the biggest thing we want to do with that is just prevent infection. And we want to make sure that whenever you're putting on a diaper, fold the diaper up under the umbilical cord, okay? So don't cover the umbilical cord with it. And it should fall off in about 2 weeks. That's when it usually takes about 2 weeks for it to fall off. And every time you do a diaper change, try to assess it, see if there's any swelling in that area or redness, any drainage or anything like that. And just, you know, just constantly look there at every diaper change. For bathing and skincare, we want you to use sensitive baby products. And those will be best for the baby and their skin, just because they have really sensitive skin. So you might want to use like baby lotions and soaps, sensitive ones. And for safe sleeping, we want the baby to sleep on their back. And sudden infant death syndrome, I'm sure you've heard of that.
I have.
Yeah, so just to prevent that, we want baby to sleep on their back, a firm mattress. They can sleep in your room, but not in the same bed with you. And then we also don't want any extra pillows or blankets or toys.
What if she gets cold?
Well, so the problem is that, you know, like having all that extra stuff in the crib with them, like they're just more likely to, you know, suffocate just because they aren't able to breathe as well at that age. And so we just want to prevent that at all costs. Now, one blanket may be fine as long as it's not like covering their head or anything like that. That should be okay. But, you know, no extra pillows or toys or anything that can crowd them while they're in there, So, yeah, just remember they should not be sleeping in the bed with you. As far as regulating their temperature, they should have a temperature of 97.7 to 99.5 degrees Fahrenheit. If there is a temperature less than 97 or greater than 100, we do want you to call us. That's not normal. You know, ways that you can help keep them warm, you know, swaddle them, just keep the environment kind of warm, keep a hat on them. I know, they lose a lot of heat through their head.
It's just so precious.
Yes, and just warm their milk. If you are using formula, make sure the milk is warm. And then to check their temperature, we want you to use a thermometer, a newborn thermometer you can use. And just basically check it up under their armpit. Place a thermometer up under there. And, you know, just hold it there until it beeps. Or some of them, I don't really know how all of them work, but most of them, they'll just beep whenever the temperature reading is done. So newborn jaundice. This is a yellowing of the skin. It can be seen in like the eyes, their face, like their head, their skin. And this is basically due to an increase in bilirubin, which is a substance that's found in our red blood cells. But this is normal in newborns,
That's good to know.
Yes, it is normal. It's very common in newborns. And it usually resolves in about 5 to 10 days. And it's just due to all the changes that are going on with their body. But if this happens, you still want to give us a call just so that we can keep a monitor on it. They may even want to bring baby in for some tests or something like that. So if you do notice that, just give us a call. And infection control. we know that newborns, they are very susceptible to infection just because they don't really have a strong immune system just yet. So we want to always wash our hands before we care for them, especially if you're having a lot of visitors.
Okay.
Please no visitors if they are sick, just because you don't want the baby to get sick because of that. And when you do have visitors, make sure that they are washing their hands too before they come in contact. Yes.
Okay.
Make sure they are washing their hands too, especially before touching the baby or trying to pick them up. Yes. Airway clearance. This, I know. You got to think babies have small, little, tiny airways. So we want to make sure that they are as clear as possible. Okay. So some ways you can do that. I know they have like those neck pillows that you can sit the baby in. And it kind of just props them up a little bit, but it helps open their airway. So having something like up under their neck a little bit when they're laying down.
But they can still like lay down in their bed flat?
Yeah, so when they're sleeping, they should be on their back flat. But if they can do tummy time, but if they're sleeping, they should be flat on their back. But they can also have like, you've never seen like the little neck pillows?
I think I have.
It's like a C. It's like a C pillow, and you can like lay the baby right in there.
Do they call that like a boppy or something?
I do not know what they call.
Well, whatever.
I don't know what they call it.
We're getting there.
Yeah.
We're new moms. I'm a new mom.
Yeah. So you can definitely use those. That'll help maintain their airway. And then just some signs and symptoms of infection in a newborn. If their temperature becomes hard to regulate, if it gets too high, that may indicate infection. If they aren't eating, like they usually would, that might indicate something's going on. They could be irritable, just whiny and crying a lot, even though they already cry a lot, but you notice that there's you can tell when there's a difference,
Okay.
And if they're grunting or having any problems breathing, like you'll see their little noses flare up because they're trying to get that air in. They may even have like some retractions, which is where you can like see their breathing, like they have small little bodies. So if they're breathing too hard, it's gonna kind of make like a little indent, a little mark where their ribs are. Okay. And you'll be able to tell once you see it. So if you start to see anything like that, like if they're having trouble breathing or anything, if they stop breathing, if they are pale or just sweaty, or if they're having poor muscle tone, so they're not like, babies, just to preserve their temperature, they normally are, balled up. Yeah. So if they're just laying flat and just laying, you want to give us a call if that happens, okay? And then some symptoms that require immediate attention. If your baby is blue, we call that cyanotic. Blue? Yes. That means
my baby can turn blue.
That means they are not getting enough oxygen.
Oh dear! Listen, if they turned another color, I think I'd take them to the doctor right away.
Yes, if they
we don't have color changing babies,
or gray, please call us immediately. Okay,
you got it.
Listlessness. That's what we call it. It's when they are just laying flat, like they're just laying out, arms spread out. We call that listlessness. And if they're not feeding, that is usually the first sign that we see, like they're not eating as much. So we want to pay attention to that. And then the retractions, like I was saying, keep a watch on that. If they have a fever, or if they are getting hypothermic, which is their temperature is too low, we want to get immediate attention, okay? And then, last one, if they are lifeless.
Lifeless?
Yeah, I know.
Well,
I know
it's hard to hear. You want to contact that doctor, don't you?
I know it's hard to hear, but yeah.
Oh, dear.
And so some routine follow-ups for the baby. It should be 1 week. Okay. And so make sure you're on that. I know that 1 week comes up pretty fast. So we want to make sure you're on it.
Okay. Listen, Nurse P, I just have to tell you, this is a ton of information. You got my back with a pamphlet?
Yes.
Good.
I will have all of this
Girl,
printed
you know
out
I'd
for
be
you.
forgetting.
Yes.
Except those things that are obviously like golf ball sized clots, you know, that's obvious. But like
Right.
some of these things,
Yes.
I might need a little tidbit sheet.
I got you.
Okay, I appreciate
I'll have
that.
all of this for you.
I appreciate
All
that.
right.
Thank you.
All right.